So Zollinger Ellison syndrome is a complex condition in which one or more tumors form in your pancreas or in the upper part of your small intestine. These tumors are called gastrinomas, and they secrete large amount of the hormones called gastrin. And this gastrin causes your stomach to produce too much acid, and in turn the excess acid leads to peptic ulcer. So Zollinger Ellison syndrome is the main cause of peptic ulcer and is a rare disease. The disease may occur at any time in life, but people are usually diagnosed between 30 and their 50th year. The medication to reduce the stomach acid and heal the ulcer is usually the treatment of Zollinger Ellison disease. This could be a possible sign of Zollinger Ellison syndrome. If you're having a very bad abdominal pain, you're having a very bad abdominal pain, diarrhea, burning, aching, discomfort in your upper abdomen, acid reflux, and heartburn, nausea, vomiting, you're feeling excessively weak, and you're bleeding in your digestive tract, and you notice that you have an unintended weight loss, decreased appetite, lack of blood, anemia. If you have any of these symptoms and you have them in batches, then you need to see a doctor. And if you're going to see a doctor, tell your doctor if you have been using over-the-counter acid-reducing medications such as omeprazole, cimetidine, famotidine, or ranitidine. Tell him if you've been using it for a long time. This medication may mask your symptoms, which could delay your diagnosis. So if you have Zollinger Ellison syndrome, early detection and treatment is very, very important. These tumors are formed in the pancreas, and they are made up of cells that secrete large amounts of gastrin, which in turn causes the stomach to produce far too much acid. Now this excessive acid leads to peptic ulcer and sometimes causes diarrhea. Besides causing excess acid production, the tumor may be cancerous, it may be malignant. Now look at this. These tumors may grow slowly, but if they are malignant, the cancer can spread elsewhere, most commonly nearby the lymph nodes or in the liver. And the forming of these tumors by Zollinger Ellison syndrome may be caused by inherited condition. And this inherited condition is called multiple endocrine neoplasia. We have type 1 and we have type 2. In abbreviation MEN, MEN 1 and MEN 2. So people with multiple endocrine neoplasia type 1 have high risk of developing peptic ulcer, and if it is not treated properly, it may result in cancer. They also have tumors in the parathyroid gland and may have tumors in the pituitary gland. About 25% of people who have gastrinomas have them as part of their multiple endocrine neoplasm type 1. Although your symptoms may prompt you to visit your family doctor or general practitioner, but you will likely be referred to a doctor who specializes in diseases of the digestive system. Or you might be referred to an oncologist, a doctor who specializes in treating cancer. Here are some information to help you to get ready for your appointment, so that you can know what to ask and what to expect from your doctor. But look at this. Prior to visiting a doctor, when you make the appointment to your doctor, let your staff know or let his staff know the medications you've been taking. Certain acid-reducing drugs such as proton pump inhibitors can alter the results of these tests used to diagnose Zollinger Ellison syndrome. That is the need you need to tell them if your medication, how long you've been taking the medication, so that they know if they need to tell you to go back and stop taking your medication. However, do not stop However, do not stop taking this medication without consulting your doctor, and possibly write down any symptoms you're experiencing, including any other one that may seem unrelated. Get all the key personal information, including any major stresses or recent life changes. Also write down what you know of your family medical history. Make a list of all your medications. Very important. Write out all your vitamins. Write out all the supplements you're taking recently. Write down the questions to ask your doctors. After that, you are done with your preparation. You're going to need to ask him, other than Zollinger Ellison syndrome, are there any other possible cause for any symptom? Then ask, what tests do I need to confirm the diagnosis, and how should I prepare for those tests? What is the standard treatment for Zollinger Ellison syndrome? Are there any dietary restrictions I need to follow? Do I need to see a specialist? Is there a generic alternative for medication you're prescribing for me? Are there any websites you can recommend to me to learn more about Zollinger Ellison syndrome? Are there any other medical problems more likely to occur because I have Zollinger Ellison syndrome? How often do I need to come back for follow-up appointment? Now, there are likely responses that your doctor might give back to you. Your doctor is likely to ask you, when did you start experiencing the symptoms? Are there any symptoms continuous, or does it come and go? How severe are your symptoms? Is there anything that improves your symptom, or is there anything that worsens your symptom? Have you ever been told you have a stomach ulcer? If yes, how was it diagnosed? Have you or has anyone in your family ever been diagnosed with multiple endocrine neoplasm type 1? If yes, what type is it? Have you or has anyone in your family been diagnosed with parathyroid pituitary problem, thyroid problem? Have you ever been told you have high blood calcium? So you need to get yourself prepared in case any of these questions comes when meeting with your doctor. Now, these are the tests and the diagnoses you need to go through to ascertain your conditions. First is your family medical history, and that is where the diagnosis starts. And your doctors will ask about your signs and symptoms in relation to your medical history. So if you have blood relatives, such as a sibling or a parent who have had or who has multiple endocrine neoplasm, it's more likely that you will have Zollinger Ellison syndrome. Secondly is your blood test. A sample of your blood is analyzed to see whether you have elevated gastrin level. It is important to note that while elevated gastrin may indicate tumors in your pancreas or your duodenum, it is also important to note that it can be other conditions. Other conditions is likely to cause increase of gastrin in your blood level. So you will have to fast before this test happens, and you may need to stop taking any acid reduction medication to get most accurate measure of your gastrin level, because the gastrin level can fluctuate because of all these acid inhibitors. So this test may be repeated a few times to get the accurate record. The third thing that might be used to check you is the gastrin level measurement. Since elevated gastrin can be caused by conditions other than Zollinger Ellison, your doctor may test the acidity of your stomach and clarify which condition is elevating your gastrin level. So gastrin level can be elevated if your stomach does not make any acid. So if you are taking medication that is blocking your acid, your gastrin level can be elevated. If your stomach is making acid, your doctor may perform a certain simulation test. For this test, your doctor measures your gastrin level, gives you an injection of the hormone secrete and measures gastrin level again. If you have Zollinger Ellison, your gastrin level will increase even more. The fourth test is effective test like upper Gastrin Test or endoscopy. It helps your doctor assess the level of your ulceration and its possible cause. So after you are sedated, your doctor inserts a thin flexible instrument with a light and a video camera down your throat into your stomach and duodenum to look for ulcers. Through the endoscopy, your doctor may remove a tissue sample from your duodenum for examination to help detect the presence of gastrin-producing tumors. And to prepare for the test, your doctor will ask you to not eat anything after the midnight or the midnight before the test. So the fifth test is imaging studies. Your doctor may use imaging techniques such as a nuclear scan, which uses radioactive tracers to help locate tumors, CT, ultrasound, MRI, endoscopy, ultrasound, all these are in imaging studies. So in this procedure, your doctor examines your stomach and duodenum with an endoscopy fitted with an ultrasound probe. The probe allows closer inspection of the digestive tract, making it easier to spot tumors. It is also possible to remove a tissue sample through the endoscopy, and you will need to fast after midnight, the night before the test, and you will be sedated during the test. So these are the recommended treatments and the recommended drugs that will help you with managing Zollinger Ellison syndrome. So if your doctor can remove the tumors, then ulcer treatment may no longer be needed. This will require a skilled surgeon because the tumors are often small and difficult to locate. So if you have just one tumor, your doctor may be able to remove it surgically, but surgery may not be an option if you have multiple tumors or tumors that have spread to your liver. On the other hand, if you have multiple tumors, your doctors may recommend removing a single large part of the tumor. In some cases, doctors advise other treatment to control tumor growth. In all these other cases that is being advised is removing as much of a liver tumor as possible. Another means is attempting to destroy the tumor by cutting off the blood supply, or he could try to use heat to destroy the cancer cells, or he could inject drugs into the tumor to relieve the cancer symptoms, or use chemotherapy to dry or try to slow down the tumor growth. So there are so many patterns that can be used to try to fix this challenge. But in a more radical surgical approach, liver transplant may be advised, or severing the nerves that promotes acid secretions, possibly removing the entire stomach in a very worst case scenario. But these severe modes are not generally done because medications are usually successful in controlling acid production and ulcers. In excess acid production, it's always controlled by medication known as proton pump inhibitors. In these proton pump inhibitors, they are the first line of treatment when it comes to Zollinger Ellison syndrome. They are the first line of treatment, and they are the most effective medications for decreasing acid production in Zollinger Ellison syndrome. Proton pump inhibitors are powerful drugs that reduce acid by blocking the action of the tiny pumps within these acid-secreting cells. And these proton pump inhibitors commonly prescribed include lansoprazole, cimetidine, omeprazole, pantoprazole, rabeprazole, esomeprazole. But you need to know this. Long-time use of these prescription proton pump inhibitors, especially in people aged 50 and above, has been associated with an increase of fractures of the hip, wrist, and spine, according to the Food and Drug Administration. This risk is small and should be weighed against the acid-blocking benefit of these medications. So your doctor may also suggest one of several operations to treat peptic ulcer, such as surgery to stop an ulcer from bleeding. Sometimes it could be to relieve an obstruction caused by an ulcer, or surgery to close up the hole, perforation that an ulcer has made in the wall of your stomach or duodenum. Alright guys, I'll be making another video on symptoms, diagnosis, causes, and recommended treatment of duodenum and gastric ulcer. So in this video, or in that video, I will be showing you the right drugs that can treat your ulcer once and for all. So don't forget to click the subscribe button and notification bell so that you'll be notified when an awesome videos is posted in this channel. And don't forget to leave your comment in the comment box below. Ask me any question or make any request on what video I should make next. I will be more than glad to respond to you. Thanks so much. Bye bye.